Hi everyone, welcome back to Probably Nothing. So it's episode 1 of series 3. Hashtag oh how time flies. And for those of you who haven't watched an episode of PN, as we call it internally amongst friends, before, basically my name is Karen. Well, not basically, that is my name. But don't judge me because I know there's a lot of hate for Karens out there. I'm a nice person and I'm here for every week we do each series. We have an episode a week where I talk to a different guest each week about a different gynae health topic. So we've covered all sorts of things from, genetic alterations and heavy vaginal bleeding in the past series. And series 3, which starts today, lucky you, is for Cervical Cancer Prevention Week, which is all this week, 18th to 24th of January. I was about to say 2020. No, Karen, 2021. I think that might be the first time I've properly said that out loud. So it's daunting, isn't it? So Cervical Cancer Prevention Week is all this week. So our next 4 episodes, starting this week, then next week, etc., are all about different things around cervical cancer and what we can do to prevent it. And we're very lucky. It's weird to kind of saying the word lucky in sort of cancer language, but cervical cancer in the UK has a screening programme, which is more than we can say for the other 4 gynaecological cancers: womb, ovarian, vulval and vaginal. And the cervical screening programme is effective. It works if people attend their appointments, and cervical cancer is largely a preventable disease. So for the next few episodes, we're going to be talking about what can be done to help protect yourself as much as possible against cervical cancer. So this week, we're going to be giving you kind of an intro into cervical screening, which is one of the key things you can do to help prevent this disease. And I'm going to be talking to my wonderful guest, who I'll introduce in a minute, because I've kind of forgot. I just said my name was Karen. I didn't really say who I am. Did I just turn up on the screen, say my name's Karen, and say we're going to talk about cervixes? No. I've been working at the Eve Appeal for about 4 years now, and I, alongside our amazing gynae cancer nurse Tracie, who you might know from a previous Probably Nothing episode, she kind of looks like me, just with a few more wrinkles, and that's fine to say because she always says that about herself, so I'm not being unsisterly towards her. And we run the Ask Eve information service at the Eve Appeal. It's a free information and kind of advice line. You can call or email us. The details will be at the end of the episode on the screen for you, about any type of gynae health query. And we wanted to start this series, Probably Nothing. We started it back in June, the first series, because we so often hear from people when they call or email us and talk to either both or one of us, sorry to bother you, it's probably nothing but XXX, and they go on to explain, maybe their period's late or maybe their vulva's really itchy. And it's kind of good in a way that, most of the time they're right that it is probably nothing, because all of the symptoms of the 5 gynae cancers, and we go on about this a lot, are always much more likely to be something less serious than a gynae cancer. But, thousands and thousands of people are diagnosed with a gynecological cancer every year, and sometimes the symptoms that person is worrying about can turn out to be something a little bit more serious. So we just wanted to create this platform so that we can have a kind of open, sometimes fun, dare I say it, dialogue, a conversation about different topics, and hopefully answer your questions, put your mind at rest, and just be really open and honest about these topics that I think often people can feel a bit uncomfortable talking about because it's down there. It's between your legs, it's in your pelvis, and we're going to talk about it. God, you can tell I haven't been in front of a camera for ages, can't you? I'm just going on and on. I've given the longest intro ever because I'm like, it's my time to shine. Right, I'm going to shut up now. I'm going to bring on my guests. It's Adriana MacNaughton. She is the Public Health Engagement Officer at Joe's Cervical Cancer Trust. And here she is. Hi, darling.
Hello, thank you for having me.
I'm so sorry I did such a long intro. I just went for it. I haven't had any attention for ages.
All right, I'll give you all the attention you need today. I actually quite enjoyed it because it gives me a bit of an understanding of what you do. Not that I don't already know, but I don't know, I think it's quite nice. You exude a lot of confidence, and I'm like, oh, lovely.
Oh,
That's
it's
what
just
I
this
aspire to be more
energy.
like.
And
Yeah.
I'm sneakily, I'm in my housemate's room. I'm at his desk because he has a desk and I don't. And he's gone to Bermuda. For
Bermuda.
work. Yeah, for work. I should stress for work, not for pleasure. He's not like a hashtag influencer that's just gone off to Dubai. No, for
Doesn't
work
doesn't
purposes.
matter. I want to be sent to Bermuda.
Okay, well, I'll have a word after this and see what I can hook up. And then next thing you'll just send me a photo on a plane, like, bye, babe. Hi. Right. Adriana, can you tell me a bit about so Joe's Cervical Cancer Trust is an amazing charity. We love them at the Eve Appeal and we love collaborating on stuff. Don't think there should be any kind of weird competition with charities. We think if we're fighting for the same thing, let's just talk about it, work together. Brilliant. What do you do there, please, my darling?
So I work in the engagement team. And I just have to say I completely agree with you, which is why we've done talks together
Yeah,
before, which I think, by the
exactly.
way, are hilarious.
Oh,
I
we
often
smashed
say
it. Smashed it.
I don't know. I've actually told people you are the best speaker I've actually seen live in person. It's true. You are hilarious. Um,
Baby.
I know. So yeah, at Joe's, I work in the engagement team. So it's my job to basically engage, which is a very straightforward way of saying it, but it's kind of my job to raise awareness about prevention, and I do that in lots of different ways. So sometimes I speak to people direct, so like members of the public. I go and speak to communities, but I actually work with clinicians, so healthcare professionals, doctors, nurses, people in GP surgeries. And so I spend a lot of time talking to them about, cervical screening, smear tests, in another word, and how to like engage with, patients and people who maybe feel a bit uncomfortable about going, people who have issues, who are worried, who are concerned. How do you make them feel more comfortable about going for screening? And yeah, basically anything to do with cervical cancer prevention. And then I talk a lot as well about HPV, which I don't think there's loads of wide knowledge about HPV. Like lots of people will say, oh, what is that? Or do I have it? Does it mean this? Does it mean that? There's lots of rumors about HPV, which are, it's kind of mind boggling, but I kind of understand because it's not, people don't know loads about it.
And if you're not, I completely agree with you. And I always think like I certainly didn't know back to me. I didn't know anything about my cervix, cervical cancer prevention or anything until I was diagnosed with the disease because you're not taught about something. So it's
Ah,
brilliant that you're getting in there before something more serious happens to someone and being
yeah.
able to teach communities about what's going on with their bodies and what they can do, right?
Yeah, I'm sorry to hear that. I actually didn't know that about you, but yeah, absolutely. I think knowledge is key. And the amount of people that I speak to and talk to them about, all of the different things you can do around smear tests and making yourself more comfortable, or just knowing a little bit more about it. They're like, oh, they totally changed my mind on, the test itself and how I feel about it, and I feel more confident talking about it, and going to my doctor and asking for this. So yeah, no, I think, and it sounds weird, like you said, you said something about lucky, being
Mm.
lucky to talk about, or funny, or whatever it was that you mentioned. But I feel like it's, in a way, it can be quite uplifting because I speak to a lot of women about, their vulva, their vagina, their cervix. And a lot of the time people do have like a bit of a giggle. We laugh about, the silly things that might happen in a GP surgery when you're having the test. And it's really nice to give people that empowerment.
I completely agree. I don't think there's anything wrong with laughing around a serious topic because it makes people feel
Agree.
better about stuff.
Oh
Now,
yeah.
first big question is who needs to go for a cervical screening? Because this is kind of the 101 intro to cervical screening. How do you as a person know if you need to go for this test that we're talking about?
Okay, so in a really simple nutshell, anyone that has a cervix between the ages of 24 and a half to 64, and if you're due, okay, you will know that you are due if you sign up so you need to make sure that you're registered at your GP surgery, and you'll get a letter if you're assigned female at your GP surgery, every 3 or every 5 years. If you're not registered as female at your GP surgery, you have to generally call up and make an appointment yourself. But it's basically anyone that has a cervix between those ages that is due.
So you have to be registered as female and registered with a GP surgery, and then you'll automatically be invited when it's time.
Yes, that's right. And
Okay.
if you're not registered as female at your GP surgery, but you do have a cervix, then you'll have to call up yourself and just check in.
Fine. Okay. So basically, if you have a cervix, you will be invited, or if not, just communicate with your GP that you also do need the appointment, even though your records show male, for example.
Yeah.
Right. And when someone says, like, "Hi, Karen, you're due for your cervical screening," I'll get a letter in the post. What happens? Do I then book an appointment, or do they just directly offer you an appointment straight away? How does that work once you're told you need an appointment?
Yeah, generally speak, it depends on your surgery because some people they're able to book online, but a lot of the time you have to contact your GP surgery first. So you might need to call up, or however the booking system works in your GP surgery. But ultimately, going for your smear test or your cervical screening, it's your choice, and so they'll never. I don't think they'll ever give you an appointment. They'll just say, you are due. And I think in the letter, you'll also get a leaflet which describes a little bit more about what happens during the appointment. And it's your choice to then go ahead. But obviously, we're talking about it because we know that it has a lot of benefits, and we think generally speaking, the benefits outweigh the risks for screening. And ideally, we want to see cervical cancer as a thing of the past.
Mm. That's so true, isn't it? 'Cause it's really good that you stress that, actually, because obviously we're gonna for the jobs that we have, we are in full support of the screening program and want to. We understand that we'll get onto that a little bit later, but we understand that it's not going to be easy for everybody to have the appointment. But if possible, we would love it if people with a cervix had this test. We obviously understand that we can't force anyone, so someone might be listening to this and thinking, "Nah, I'm not going to go," and fair enough, it is your
That's your
body.
choice. Yeah.
Exactly, your body, your choice. We really support it, but we also respect people's right to choose not to
Yeah.
do something.
Absolutely. Yeah.
So right, I've got my appointment. What happens? So obviously there's the caveat with COVID. So if this was pre-COVID time, we'd be saying, oh, just like rock up and hang out in the reception area, and have someone with you if you want, and wait your turn, etc. But obviously appointments now, because of COVID, again, we'll get on to kind of the delay side of it in a minute, but there's we'll caveat this with you'll be wearing a mask, you'll probably wait outside for the appointment, etc., until called in. But typically speaking, whatever your GP surgery's protocol is for waiting, to get into the room during COVID times, once in the room with the nurse
Yeah.
or doctor, what happens?
Okay, so first of all, we hope that the nurse will put you at ease, basically. And normally they do that by just having a bit of a chat, welcoming you into the room. They'll ask you to sit down, and because we know that for some people it feels quite uncomfortable. It might make people feel nervous. People might have really strong feelings for it. So the first thing the nurse or doctor or whoever the sample taker is hopefully making you feel more comfortable. And then ideally they would check with you what your past history was. So sometimes they'll say, have you been for a smear test before? Do you know what to expect? And they'll kind of run through the basics of hopefully what happens. And this is a really good opportunity. So for you, if you have any questions or if you're feeling nervous or anxious, just say. Lots of people say to me, like, "Oh, I was really nervous about going for my smear test," and I was like, "Did you mention it to the nurse?" And they were like, "Oh, I didn't want to tell her, and I didn't want to, seem, like I was causing a bit of an issue." But there's loads of things that the nurse can do to kind of make you feel more comfortable. And after that, assuming that she's checked your knowledge and you're definitely due for your test, you'll get she'll lead you over towards the couch, and she'll draw a curtain or give you some privacy to change or undress. So usually, if you're wearing a skirt or a dress, you can just take sort of your knickers off, or just basically make sure that your bottom half, just remove all the clothing.
But how
And then
funny is it when you go in the I've had like gynae appointments in the winter, and you've got like a scarf, coat and jumper on, and then you take your coat off, you've still got this really thick jumper on,
yeah,
and then
and it's like
nothing on
top
the waist
heavy.
down. Yeah.
Yeah,
And you've
yeah,
got like fluffy socks on, like completely butt naked, and then a big
yeah,
fluffy jumper, and you're just
yeah,
it's
yeah.
just so funny.
Oh yeah, I've been there. But like the tip to, and like I totally get that not everybody wears skirts or dresses.
Yeah.
But I actually find it so easy, or much easier than having to remove all your trousers. Like, because at
You
least with a
take your
skirt you kind of,
jeans off and stuff, and oh
yeah,
yeah, yeah,
yeah, it's
yeah.
just a lot of effort. So I just remove my pants and then, flash them a bit. Um,
Love it. And
um,
Lydia, who works with us at Eva Peel, once went for an appointment in a jumpsuit. And she was like, oh no.
oh, that's so funny. So she had to get completely naked. I mean,
So
fair
she was
enough.
just lying there, like she was having some sort of full body massage.
Oh, bless her. That is courageous. I love it so much.
Yeah. So if you're finding
Um,
it, who cares? But a good tip is to just like hitch your dress or skirt up, isn't it?
Yeah, yeah. So basically she'll give you privacy to change or to, remove your knickers, and then knickers or pants, I should say. And then, when you're ready, you can call the nurse over and she'll come over. She or he, sorry, I can't make any assumptions, can I?
Can you ask for a particular gender of healthcare professional though?
Yes,
So
absolutely.
because you
Yeah,
might feel I think the majority of people watching would assume that they would have a female
yeah.
healthcare person, but somebody might want someone who is male due to their own experiences or whatever. We don't know.
Absolutely. Yeah. So I've met lots of patients, and sometimes they prefer a nurse or a doctor of a certain gender, and that's absolutely fine. And you are well within your right to ask for it.
And
And I remember, like, when I was,
do you say that when you book the appointment, you call up and
yeah,
say, can I just check, like, hi, it's Karen, I'm booking my cervical screening. I can do that date. Yes, thank you. Can
yeah,
I please check it's a female person doing it?
yes. So it's something that I was going to raise actually. So when I was younger, I always felt too nervous to ask, and I felt like, oh, I'm going to cause a problem if I ask, and I might offend someone. And now I'm like, no, it doesn't really matter. You can just call up and say, hi, I would prefer nurse or doctor of this gender, and it's absolutely fine. But generally speaking, the majority of sample takers that I've met and have trained and worked with are generally female.
Yeah.
So yeah, it's absolutely fine. And you know what? Even if you turn up and it's someone not of your preferred gender, so if you didn't want a man, for example, you don't have to have the test. You can say,
Mm-hmm.
I'm really sorry, I'd like to book him for another time. And that's absolutely
So
your
important.
personal,
Yeah.
yeah, yeah. So
I
you
think
should feel like empowered to be able to make that choice yourself.
I think we've got a real kind of well, I think it is a problem in our society where we don't want to, like you were saying, cause a fuss or cause a
Mm,
problem or be
yeah,
seen as like causing trouble or putting anyone out. And I
yeah.
understand, like if you just like book in to go for a coffee with your friend instead of going for your screening, that is mucking around the nurse. But if you
Oh yeah,
get
yeah,
there,
of course.
yeah, that's no, don't be a bitch. But if you get there and the situation you just don't feel comfortable with, even though you've got the appointment right there in front of you, you don't have to go through with it then and there, because it's
Absolutely not.
it can be
No.
a big deal for some people, and do it when you're comfortable.
Absolutely. And like, one of the things we say about screening is, you could be halfway through your screening appointment, and if for whatever reason you feel like you want to stop, that is well within your right. So the point of screening is that actually you're in control. And the nurse or doctor or whoever it is that's taking the test, they're there to take the test, but you are in control. So if you ever say, stop, I don't want to do this anymore, or I feel uncomfortable, or can I just come back another day, absolutely fine. That is well within your right. And that's something that I kind of stress quite a lot, because sometimes people feel a bit uncomfortable about saying it. And absolutely, it's your choice. You can do whatever you want within
Completely
reason.
within reason. Yeah. So when you say hello, I'm ready, so you've taken your bottom half of clothing off on
Yeah.
the couch, what happens then when the nurse or doctor comes kind of past the curtain?
Okay. So hopefully they will explain to you what they're doing before they do it and check with you that you're happy with that. But basically, there's something called a speculum, and it's just an instrument, I suppose, that they put inside of the vagina, and they basically use it to open it up because they want to see the cervix. So the cervix is at the end of your vagina, and they yeah, absolutely. And it's a little bit like looking down someone's throat. So they basically just need to open it up. And I think usually this is the part of the test that most people find a bit strange, because it's kind of opening up uh, your private parts basically, and it feels a bit odd. Most people say it feels a bit strange, but not necessarily painful. But for some people, it could be painful. But this is the time where you can communicate with your your sample taker and tell them how you're feeling, and oh, that feels a bit uncomfortable or whatever. But usually, for most people, I think it just feels a bit strange.
Mm. And it's weird, isn't it? Because I definitely didn't know until all of this gynae stuff went down. That like I just presumed, like I knew where my vagina was, but I just sort of presumed it was kind of always open, if that makes sense. So I
Yeah,
remember I was really surprised when I learned that the speculum holds the vagina open. I was like, what do you mean
yeah,
holds it open? It is open because it has, blood comes out. For me, a penis goes in. Like it's always open, and it's not. It's closed, and it is
yeah,
opened when something is coming in or out, right?
yeah, absolutely. It's a bit like your mouth, I think. So it's not just open the whole
Not just like
time. Yeah,
it
so
has.
it's a bit like, it's not completely like your mouth, but
Yeah,
it's basically, it's closed, and they have to basically put the speculum in. And the reason why they have to use the speculum is because they want to see the cervix, because they need to take a sample from it. And if they need to make sure they're getting cells from the right, or sorry, they're taking a sample from the right area. So what they'll do is get a brush, and it's a silicone brush. It's really soft.
so
And
it's not spiky. It doesn't. It's not kind of hard
yeah,
bristles or anything.
no, so I think that's a common misconception. People don't really know what to expect. But the brush it's almost like a makeup brush. So I often show it to people and like put it against their face, and it's super soft. And basically all they do, it's quite long, so they kind of just put it in so they don't have to put their hands too close. And they spin it around, take a sample from the cervix, and then basically as long as they can visualize the cervix, they can see it, they get a sample, they take it out, take the speculum out, and that's the test done, really. I kind of compare it a little bit like, let's just say, like a dentist wanted to take a swab of some of the cells of your throat, right? So they kind of need to get in, and it's a bit uncomfortable because you're a bit like,
Mm.
they kind of take a swab and then, send it off. Like for me, my personal experience, I was really worried it was going to be like painful, and I didn't really know what to expect. And I remember the nurse, I think it was less than a minute. It was about 45 seconds she took the sample in. And I was like, oh. And, I get that it's not always the case for everybody, but for
Mm.
me, I was like, oh, I've heard, people tell stories, about they had a test that didn't go as well, or, they didn't really like the nurse or whatever. But it's not always awful or terrible experience.
And we do hear the horror stories more, don't we? So
Of
I think
course,
whenever we, kind of talk about screening and encouraging screening, we understandably, and I don't mean it as a
yeah,
criticism at all, we hear from the people who have struggled, and they say, well, actually, it's not that easy for me. But for
yeah,
the majority of people, it is a fairly quick appointment, and it is
yeah,
fairly painless. It's kind of fairly quick and a little bit of discomfort kind of at the most, for
yeah,
most people, fine.
yeah.
And so is the appointment, is it kind of like a normal 10-minute GP appointment that you'd book yourself in for? Is it less because it's a quick test, or well, relatively for most people?
So this is where it changes from GP to GP. Some GPs offer it in 10 minutes. If I'm honest, I actually think that's probably a bit too quick, because you don't want to, like, some people are fine and it can be super quick. But if you are feeling a bit anxious and you need a bit of time to relax, you can actually ask for a double appointment, but they range from 10 minutes to 20 minutes. So, there are some people who maybe have an anxiety disorder and they feel really anxious about it, or they have a lot of questions. You can say, can I have a double appointment, please? And, that's absolutely fine as well. And, lots and lots of GP surgeries will be happy to offer that. I speak to, nurses and doctors all the time, and they're like, yeah, if people need that extra time, absolutely fine. But yeah, anywhere between 10 and 20 minutes typically.
So the key here is, isn't it? It's just communicating with whoever is looking after you, the person on the end of the phone when booking the appointment. If you know that 10 minutes from start to finish of walking in and having, getting undressed, putting your clothes back on, and having the test in between that, if you know
Yeah,
that's not enough time because of
yeah,
however you know yourself better than anybody else,
yeah,
simply just communicate that and say, please can I have a longer appointment because I know
yeah,
I will find it more difficult.
yeah. And the reason why they offer screening is because they want us to take it up. And so anything that they can do to try and make you feel more comfortable, And this is one of the things that I speak to practitioners about, and I'm like, do you let people know that they can book double appointments? And they're like, oh, we don't normally mention it. So how would people know? So this is what my job is, to kind of let people know that is an option for them.
And so they've taken a sample from the cervix of cells, swept over, taken a sample. What happens then? What is the test actually doing? Because it's not a cancer test. You're not being tested for cervical cancer. It's not a diagnostic test. What is it?
It's a preventative test. So that's a really good thing that you've brought up. So lots of people will say to me, oh, I don't want to go for screening because I'm really worried they're going to find cancer.
100%. Yeah.
And I hear that all the time. And I'm like, well, in a way, this is a really good thing, because we're not actually looking for cancer. We're looking for something which, maybe in 5 or 10 years might be a problem. It's preventative, so we don't want any cancer to develop. So what they're actually looking for is HPV. So HPV is a virus, and it basically infects the cells of the cervix. It's really super, super common. Almost all of us will have it at some point in our life. But sometimes if you have a tricky strain, basically it irritates the cells of the cervix. And when we go for a smear test, what they'll look for is HPV. And if you have HPV, they'll then look at the cells. Okay. So if your cells look like they've been irritated a little bit, sometimes they go a little bit wonky, and that's what they're looking for, basically. So they just want to check that the cells look as they would normally. And if they don't, they can then give you some treatment, and that will stop, or hopefully stop, any further problems developing down the line. So it prevents cancer from developing. So the campaign that I actually work on is called Eradicate Cervical Cancer. And they think in 50 years' time in the UK that we would completely be able to get rid of this disease, which is incredible, because we can literally get rid of this cancer. People won't have to have this anymore. And so,
is that because HPV causes like such a high percentage of these cervical changes / cervical cancers?
Yes. So there is a bit of dispute about how many cancers it causes. It's officially at least 99.7% of cervical cancers are caused by HPV. Some people think it's actually higher. It's 99.9% of all cervical cancers. And there are some people who think actually it's all cancers that are caused by HPV. And, there's human error in there where they haven't picked up HPV.
Yeah.
And so, this is obviously, I don't want to put doubt in anyone's mind. Officially speaking, it's 99.7%. So it's pretty much all cases, bar potentially a few.
So it's not a test to say, hello, Adriana, you've got cervical cancer. It's to say, okay, Adriana, you've got this virus, and some of the cells have started to go a little bit wonky. So we're going to either monitor you, because again, depending on how severely changed the cells are, you'll either be monitored or they'll be removed. But this is the beautiful thing about screening, is that you don't have to get to the stage of being diagnosed with the disease. It can be intercepted, right?
Yeah, absolutely. So we don't want it to develop into something worse. And that's kind of the whole point of it. We want to stop it before it ever develops into cancer. We don't want any women or anyone that has a cervix to go on to develop any cancerous cells. So if we can prevent it, then great.
And what would you say to people? So I'm sure you have to hear about it all the time, because I know I do, and you focus solely on cervix, so probably hear it 10 times more. But people are panicking because of the pandemic. So screening was stopped in the first lockdown for a few months. And Joe's did a report. I remember the stats was over 600,000 extra people missed their cervical screening because of the first lockdown pausing screening services. This lockdown, touch wood, they've not been officially stopped. But we need to stress, it is like you were saying, each GP surgery is different. So, for example, just before we went and started recording this, I was just telling Adriana that I spoke to a nurse the other day who is the sole sample taker at the practice she works at. But she, for her own health reasons, has to shield. So obviously, we're out here saying screening hasn't stopped, but then her 100 patients that are due are being told, nope, and the nurse, whatever her name is, can't do your sample. So that's going to be really frustrating for people, and she then has to find other nearby practices that can accommodate, because people are now delayed. what advice would you give to people thinking, oh God, I've just had a letter saying it's due, but can I book it or should I go because of COVID? What do you kind of say to that?
Yeah, like I think this is a really common thing. It's something that we've heard on our helplines all the time, and people write into us and they say, can we still go for screening at the moment? So basically, yes, there's nothing saying that you can't go for screening, but I kind of understand that the pandemic has caused a whole nother lot of anxiety. So if you're someone who is potentially clinically vulnerable and you're worried, it's completely understandable. But generally speaking, GP surgeries have taken so many steps to keep people safe from, picking up, coronavirus, basically. So if you're particularly worried, call up your GP surgery and ask them whether or not it's safe for you to go and book an appointment. Sorry. But generally speaking, if they're offering appointments, then absolutely. And, they've got really rigorous cleaning programs, so they sanitize everything in the room, basically in between patients. They usually have PPE, so they're wearing masks or face coverings. They might ask you to wear a face covering. But absolutely, just call up your GP surgery and ask them to talk you through, whether it's safe at the moment and, what steps you might need to take. So I know, for example, some GP surgeries, they're asking people to wait outside until their appointment. So there's no waiting room anymore. So patients have said to me, oh, I don't want to go and sit in a waiting room with loads of coughing people and then get sick.
You don't have to.
That's,
Yeah.
yeah, that's not really what's happening anymore. And then, some surgeries, they'll have doors into the actual, like the room itself. And so you won't go through like the main route. You'll literally go straight into the room, and it's been sanitized before you've got there. And it'll be sanitized after you leave. So generally speaking, they've taken so many precautions to keep you safe. Talk to your healthcare professional about it. And I think it's a bit of a shame, like you said, the nurse, if she can't do appointments for you, the surgery should arrange for other appointments, for you to get it somewhere else
Yeah.
at a time or place that's kind of convenient for you.
And what would you say, so to people, what advice would you give, Adriana, that, say someone has had their screening cancelled because of the first lockdown and is now overdue?
Yeah.
What advice would you give for someone that's kind of fretting that their upcoming appointment that's been rescheduled is going to deliver kind of bad news because they had to wait 6 months extra?
Right. I can completely understand, like, if your appointment was like delayed, it can cause some anxieties. And I don't want to say it's a good thing, but I do say it's a good thing that cervical cancer is actually a really slow growing cancer. And, it takes a very long time for HPV to, generally change the cells. So 6 months is, it's not really a long time. Cervical cancer takes between 5 and 20 years to develop. And that's why they'll always check you every 3 or 5 years to follow up and basically check to see if you have HPV, which we know might cause potential problems later down the line. So really 6 months is nothing too much to be worried about. I think the best thing to do is get checked, really, because the sooner you get checked, any problems that do arise can be treated. But to be honest, it's quite rare. Cervical cancer, it's very, very, very unlikely that they'll ever diagnose that from a smear test. So I think, just go and get it checked and try not to worry too much.
And you was talking earlier about how, for example, someone can book a double appointment if they're feeling kind of anxious, or we we're saying we understand that for most people it's fine. For some people there are barriers. That could be anything from needing to use a wheelchair and finding it difficult to get into the room, through to kind of like a previous trauma that has meant that the examination is just something they aren't able to go through, which is understandable. What kind of advice would you give healthcare practitioners if they have a patient that has some additional kind of needs or barriers or requirements?
I think the most important thing a practitioner can do is listen to the patient. There's nothing better than asking a patient, okay, hi, like, welcome. It could be over the phone or it could be in the appointment itself, but just talk to them and ask about, what it is that they can do to make you feel better. And it could be something simple as, do you want to put the speculum in yourself? Because that's the part that people feel a bit uncomfortable with.
The
And it gives you
control element
control.
sometimes, isn't it?
It's
Yeah,
the
exactly.
control. I'm putting in the speculum into myself, and I'm doing it at a pace that feels comfortable to me. Some people want to listen to music. You know what? Some people selfie, call their mates, and they'll
Yeah,
video chat their mates, which is
yeah,
great. And if
yeah.
someone can sit there and distract them, they can take you through breathing techniques. But I think practitioners, they, as long as you're listening to the patient and trying to basically make them feel as comfortable as possible, then you're going to get the best outcome. Because then people will go and be like, you know what, my nurse is just amazing. She was so lovely. I was in and out. She made me feel at ease. Or, I was really anxious about it. She did everything she could to make it as comfortable as possible. And I think that's the most important thing, really.
Completely. And I think there's lots of people that sometimes think, oh, I don't need one, or I've spoken to so many women who have sex with women and have been told by
Yeah.
a healthcare professional at some point in their
Yes.
life, oh, you won't need that, that's just for girls who have sex with boys. No.
Yeah. Not true.
No,
No.
HPV is passed on through any type of sexual contact. So two vulvas together, HPV, oral sex,
Yeah.
anything. So, for
Yeah.
example, say someone who has, had sex with a woman and never had any kind of penetration, they might need a smaller speculum, mightn't they? Because their vagina
Yeah.
won't be as used to anything going inside. But like you were just saying, you just have to talk to the person that you're in the
Yeah,
room with.
absolutely. And
And
another thing that
healthcare
I should,
practitioners aren't mind readers, are they? They need
no,
to know
absolutely
the
not.
barrier.
And the one thing that people aren't aware of is that there are different size speculums, and so like I now sometimes nurses will say, "Oh, just so you know, you're like a medium long," and people will be like, "I know now." When I go in, I'm like, "I'm a medium long speculum
Like a
size," and I'm
bra
like,
size for your
"Great,
cervix, isn't
yeah."
it? Yeah.
Yeah, and some people say, you know what, it's more comfortable for me to have a smaller speculum, and you can actually request that, and it's if that makes it more comfortable for you, then brilliant. So absolutely, do everything you can to empower yourself, make sure that you feel like you're in control of the test, and hopefully you'll get everything that you want from it in terms of like good results, I suppose. Well, not
Good
good
result.
results, sorry, but
You
results.
did well,
Result,
yeah.
yeah, did well, and you had an experience that made you feel comfortable.
I think I could not agree more. And we are coming up to the end. So can I just ask you to give a few takeaway tips if someone doesn't want to go or isn't sure what to do or doesn't know why they should bother, or is just kind of like, oh, my first one's coming up, and is it important, does it what kind of 3 things would you say to someone that is brand new to the world of cervical screening?
I would say that this is a test for you. You are in control of the test, and the test, the smear test or cervical screening, the test is there to prevent something like cancer from developing. And so if we can do that and prevent anything bad from happening, then ideally we think the benefits outweigh the risk. And the top things that I would say is speak to your healthcare professional in order to make it as comfortable as possible for you. And there are lots of people who go for screening and don't have any issues. But for some people who feel really anxious or worried, just have a chat and see what kind of things you can do to make it more comfortable for you. And if it's something like bringing a friend, or they call it a chaperone, so bringing someone that you trust, like your mum or a partner or whoever, ask if that's possible. It might differ from due to the pandemic how many people they can fit into the room, but it is something that you can ask for, and they'll generally speaking, they want to accommodate you and make it as comfortable as possible.
Oh, what a gorgeous note to end on. Thank you
No,
so much, Adriana. You were
thank
a
you for
darling.
having me.
Go and hide backstage while I sign off, and then we'll just have a
Okay,
little kind of set. Thank you so
thank
much.
you, bye.
Bye. Oh, isn't she lovely? Now I'm looking back at my fans. Sorry, the audience. Oh, I'm not on stage. Thank you so much, everybody who watched this first episode of Series 3 of Probably Nothing, all about cervical screening, a 101 on cervical screening. I think hopefully you found that really helpful. You can always watch it on playback if you've not watched it when we go out live. Next week, which is the 26th of January, we're going to carry on with the theme of cervical cancer prevention in honour of Cervical Cancer Prevention Week, which is this week. And we're going to be talking about HPV for the whole session. So the virus itself, the HPV vaccine, and what happens if your cervical screening results say that you have HPV, kind of next steps and monitoring after that. So we'll see you next week, Tuesday, 26th of January at 6 p.m. Until then, thank you so much for watching and stay safe.